don't start with good news and say, "Hey, your sinuses are fine," but by the way, the bad is really bad. Your brain is leaking.
Right.
That is terrible. You don't even lead with good news when your brain is leaking. You get right to the point.
Well, she didn't say that my brain was leaking. She said it could be leaking, and we need a different type of test to see if that brain, because there's literally it's like a membrane that is around between your brain and the rest of your body, right? You've got your brain, your skull, whatever, but between
Right.
things, you've got this really thin membrane. Welcome to Going Deep with Michelle and David, where curiosity leads the conversation. From business and creativity to spirituality, relationships, and the things that people don't always talk about out loud, we like to explore those topics that make us think, grow, and see the world a little differently. No scripts, no surface level chatter, just real conversations that go a little deeper. Thanks for joining us. This is the inaugural episode of Going Deep. I'm Michelle.
But but we will use Chat GPT for that brilliant intro.
Yes. Yeah, that's the only script we have is
I
is the combo of me and ChatGPT.
I thought it was brilliant.
It's not AI is not as bad as people want it to be.
No, I fear AI. I don't want it to be AI. In fact, if there's going to be AI for anything, and I just thought about this the other day, I mentioned to my doctor at a checkup that I have to get that I urinate at night, like I have to get up to pee, and he was like, "Oh, let me use this opportunity to see this handsome young man's keister. We're going to
Oh
do
dear.
a prostate exam." And
Well,
it
why are you peeing in an unnormal amount? Like most dudes get up at night and pee.
Yeah, that's what I thought. I drink a lot of water because I usually do a night workout, but he thought, I mean, he wanted that this was the day where he was like, "I'm going to scare you, David, and let you know that you could have prostate cancer." And I was like, "What? Because I pee at night?" He was like, "Better to be safer than sorry." And he started to put a glove on, and I was like, "Don't do that."
Nuh-uh.
Yeah, he was like ready. He was like, "Let's do it right here, right now." And I was
Did
like,
they
"Can we?"
call in somebody else? Like usually they have to have a witness.
No, it was just
David.
him, and he's a young looking doctor. He looks like he's 20.
Ooh.
He's like 5'1", and I'm 6'4". Like that's a weird combo. My 6'4" frame bent over and this
So
five
going
one
deep has a
gentleman.
different meaning for you today.
No, I didn't do it. I told him wait till our third date because I've only seen this doctor twice, so it's happening in April. But it had me thinking, like AI can do all these things. Why can't we just have AI
Check your
somehow?
prostate.
Yeah, like Chat GPT it, like, "Hey, do I have?" And then it just lets me know. Or we have like an AI thing that does the business in privacy, and you don't have to interact with another human.
I'm sure there are places that do that. Like we are so far behind. I was watching a video the other day on YouTube. It's Shenzhen, China. They are like 20 years, 30 years ahead of us. And
Yeah.
it's insane. And like you can travel to Turkey and have a whole body check for less than paying your annual fee to have health insurance here in America. So you
Oh.
could probably have a rectal exam by
Well,
a without having it to be a probe, so to speak.
I just wrote down look up AI probe or AI finger. I'm going to Google that, see if there's one out there available. But my doctor is
That's what you
Asian.
got from what I was saying, AI finger.
Yeah.
No,
Right.
like they can do a body scan that sees everything. Like you don't need anything put in your body. It does the different layers of tissue and it's like an MRI on steroids.
Listen, I don't want to mansplain the prostate to you, Michelle, but I'm pretty sure they have to go up there and make sure it's not swollen. I don't know why I use two fingers.
I don't
I just,
I feel like I'm gonna be the ew, David.
yeah.
Ew, David.
Well, how do you think I feel about it? I'm the victim.
I mean, maybe some listeners or viewers have been through the process and can tell you it's not that bad.
No, they've all told me just get it done, get it over with. There's nothing enjoyable about it.
Hey, as a woman who's been probed since she was like 13, you can handle this.
So we'll move on from that because I don't know what to say after that without making
Yeah,
it too awkward.
exactly. Women have it a lot harder just because you've got one thing. We've got all internal plumbing.
You guys have a lot of working parts. I don't even understand it, to be honest.
Yeah,
I've
because
seen the
we're a
pictures,
dude.
I've taken the classes, I've seen them in real life, and I'm just like, that's a lot. There's a lot going on. I'm just going to do my best and figure it out.
Now you know why we have different personalities on different days of the month.
No, that's never explained either. And I have
No, it's
chat
because
GP
of all
that.
of those parts. Just agree. Just smile and nod. Every woman
I've
knows what I'm
learned.
talking about. All right. So,
Yes.
David, we've talked about probing. How are you today?
Uh, well, now I I
Do
feel
you feel
very
vulnerable because you
vulnerable.
shared that you
I
need
feel
to
way
be
too vulnerable.
probed?
Hmm.
Maybe
And
this was too serious of a conversation to start off with. It was too real for you.
that's the most real I think my life will ever get is when a doctor wants to do something like that to me, or
Think
anybody for
about
that matter.
every think about every leading man, right, in movies and TV that is over the age of 40. They have done it. You too can do this.
Yeah, but they're beautiful, and they have a whole team that just takes care of everything, like their whole body. They're waxed and sculpted, and just clean. I just view them as clean. Like they're gonna. That's gonna be an enjoyable experience for a doctor. Like that's gonna. I'm not. I'm just a regular guy. That's disgusting.
So
It's disgusting.
go get your butt shaved.
I'm not. I'm not hairy.
You just
Not
said that they were
hairy.
all clean and
I said they
well,
were
I
clean. I didn't say they
imagine
were
waxing.
shaved.
I don't know.
I said nothing about their shaved keister. I have a baby smooth.
Anywho,
Maybe I'll get bleached for the first time.
oh my God.
Be like,
How do
Doc,
you even do that? I'm sure like in LA it was probably common. But like, where do you
I don't
find a
know.
place to be like, yo, I need you to wax and bleach my behind, please?
Underneath Google AI probe AI finger, look
Ah,
up
AI bleaching.
bleach clinic.
I'm sure like a day spa or something does it. I've just never seen it on the list of services offered.
Can you just do it yourself? Can you just go to Walmart, buy a bottle of Clorox, and
I think it's a different kind of bleach.
I'll try it.
Got to be body safe bleach. Oh, you know what? It could be like the same as the hair dye.
I'll report back. I've tried the hair dye.
Yeah, you had frosted tips back when I knew you the first time.
Oh God, let's move on.
They're back. You could get them again.
No, they're not back. And if they are, they shouldn't be. If someone's trying to bring them back, they shouldn't. Don't
Oh,
do that.
kids today. They've got the
Yeah.
frosted tips. They've got the faux hawks.
No.
All right, Mr. Vulnerability. How do you feel since you shared that very vulnerable situation that you will be in?
Yeah, moving on from probing. Um, what we actually came on here to talk about is when you violently made me share a month ago and be all vulnerable. You forced it.
People love your ability to be open and honest. And for
You
some reason, when I talk to you, I tell you stuff that I've never told anybody else. So I thought, why not? Let's get vulnerable.
well, tell me how you are.
About being vulnerable. Mm, so the stuff that I told you about the brain surgery, I haven't really told anyone. People are seeing the clips and they're like, "Oh my God, I didn't know that you had to go through all that." And bleh. But that wasn't even the scariest. Like this is gonna sound weird, but
Nothing sounds weird.
what it was, I think it was last year. Wait, what year is this? Okay, maybe it was a year and a half ago. I started having problems again, and I keep getting headaches and just I don't know what was going on. So I went back to the doctor who had found the brain tumor to have my sinuses looked at because it was like all up here. And so we go and I get the test done and she shows me the scans and she says, "Okay, well, good news. Your sinuses are fine. Structurally, there's nothing wrong with them." She's like, "But see right here?" And I'm like, "Yeah." She's like, "Well, we can't really see if your barrier between your brain and your nasal cavity is there. She's like, it may have been cut through, like you could just be leaking brain out your nose, basically, is what she was saying.
Well, you don't start with good news and say, "Hey, your sinuses are fine," but by the way, the bad is really bad. Your brain is leaking.
Right.
That is terrible. You don't even lead with good news when your brain is leaking. You get right to the point.
Well, she didn't say that my brain was leaking. She said it could be leaking, and we need a different type of test to see if that brain, because there's literally it's like a membrane that is around between your brain and the rest of your body, right? You've got your brain, your skull, whatever, but between
Right.
things, you've got this really thin membrane. And she was worried that maybe they cut through it and it didn't grow back, or something was going on, and maybe that's why I was having all these symptoms again. So for like a month, I'm thinking I'm dying. I'm thinking that my brain is going to leak out of my nose, because you've seen those stories where it's like it's spinal fluid coming out of someone's nose, or like weird things. So
Right.
the month of October, thought that was happening to me. And I went on vacation because I was like, well, if I'm gonna die, I might as well go visit my brother and say hello.
Yeah.
Um, and then when I came back, we did the tests again, or I don't remember. Like honestly, like I block a lot of stuff out, so I can't really remember. But
Hmm.
turns out I'm fine. The membrane is intact, and she just made me worry for no reason whatsoever. But that was more scary to me. The thought of having to go through it again and it being worse than the first time, that shook me to my core.
Yeah, I bet. Oh
And
my
like
gosh.
nothing mattered anymore. And people were like, nothing mattered. Like when you're facing something like that, like a press release that you put a typo in because
Right.
you didn't have your assistant check it, like who cares?
Yeah, it is fascinating when life threatens you like that, because then you really start to gain some some insight into what you really care about. Like, will you care about this on your deathbed? Like, what's really important to you? And it's actually kind of sad that some an event like that in your life will lead you to think like that. If you could think like that every day, like, okay, if I, when I died, is this something that's really going to matter?
Right. We
What?
stress ourselves out over all the little
Yeah,
things that make no difference in the long run, but we're conditioned to worry about crap that doesn't matter. Like, I don't know. I mean, you should always want to put your best foot forward and, do your best. But in the
easier
end, like,
said than done.
right.
I love that message. Live life. Live. I'm going to write this one down too. Live life like your brain is leaking. Through your nose,
No,
and then
dude, it
ask,
was it was not fun. But
"What a
still,
scary month."
yeah. And then yeah.
And I think
And
it's crazy. Like, you didn't reach out to like me. Did you tell anybody that you had that fear, that concern? We're so afraid to share that fear, that concern. Why?
um like a few people knew,
Oh my gosh.
like family, I think, because we were all waiting on the results. But
Yeah, I get
I
it.
didn't really tell anybody like the depth of how freaked out and worried I was, because I'm lucky enough to have had brain surgery and be on the other side of it, and then to get that, you know what I mean? Like anyone, luckily I did not have cancer. I know a lot of people who have cancer now who had it before. When it comes back, they get more scared than when they were first diagnosed.
Sure. Yeah.
So,
Well, I'm glad you're here, but I just find that so fascinating that we keep things inside and struggle alone. Like
well, yeah,
like you
because
went
why
on.
bother anyone else? They don't need to worry about it. It's my burden to carry, right?
No,
I
I mean,
know.
if it benefits you, you have people in your life that love you and care about you. That's what we're all here for. It's not so much about. just you being happy. It's everybody being happy together.
I
Like
know. I get it now, but still, it's hard to share things.
well, I am glad you didn't call me and share that your brain is leaking because I wouldn't know how to take that seriously, to be honest. I would just be like, well, can, you got a
Yeah, sucks
cork?
to be you.
Can you put something up your nose? I don't know.
Well, that's why I didn't like that's another thing. That's why I didn't do the brain surgery that way because that was one of the options. They could have gone through my nose and left a hole between, like, just left a hole in my skull inside to get into the brain. And I was like, no, because then I'll just always have a hole that's going to my brain. Like, what? So
See,
I
this is
told them to, rip off my
right.
forehead and
And you have a beautiful forehead still to this day.
thanks. I was trying
But
to hide.
this is why you share things because you don't know how your story, yeah, you don't know how your story will impact somebody. Like you just affected me for the positive because now that you shared that put things into perspective for me. I'm no longer that concerned or anxious about having a finger up my butt or
Well,
two
I'm happy
fingers.
that my brain barrier scare could help you feel better about a prostate exam.
How many fingers do they use? Do I need to stretch?
I'm the wrong person to ask. I did have a gynecologist do that without warning me.
Should I practice for my prostate exam? I'm going to Google that too.
I'm honestly, I think you'll be fine.
I will. Well, I love that you were just vulnerable there. I love when you're vulnerable. It does come with consequences, though. Now that I'm learning, now that I shared, what was that?
Yeah,
A
so
little over a month ago?
yeah, we had so I have another podcast called What If God Is Actually Listening? Um, but it's not really about God. It's just about, the struggles that people go through in life. And David joined me to talk about his sobriety journey. And now he's getting some fallout from it, right?
Not necessarily fallout. I just find it interesting, and it's not even necessarily a sobriety journey either. It's a mental health journey.
Mm.
That was something that I never took seriously because I wanted to perceive me. I wanted to come across as this funny Joker guy, and I am. I always will be.
Yeah.
But I'm also, I also deal with regular normal things too that everybody deals with, and we're so afraid to share that. So I'm learning that there's a price at being vulnerable. And the one thing, and I don't know why, I was letting it irritate me, and then I had to like take a step back and be like, no, people are just coming from a good place. But so many wanted to, like me being vulnerable was me opening the door for everyone to solicit their advice and what they thought was best. And it's like, oh, you should do this, you should do that. Whoever so and so in my life went through this and did this, or I went through this, and you
Hmm.
need to do that. You need to take these pills, go to AA, go do this, go to church. Go. I'm like, good Lord. And it was just so overwhelming. I'm like, I'm seeing a therapist. I think I'll just take advice from them, and I appreciated it.
Yeah. I
But I
don't know
didn't.
why that happens, but I think it's because we are conditioned to hear someone struggle and try to fix it, right?
Yeah,
So, like, let me throw what I know at it. Even though you didn't ask, you didn't say, "Hey, have you ever, gone through this? What do you recommend?" If you were to say that, then that makes sense. When people are like, "Well, journaling helps me," or I don't know, whatever. But you didn't
right.
ask. You were just being vulnerable, saying, I'm going through this right now. And people are like, oh, do this, take a pill. Life is great on pills. And you're like, I'm trying to not be on anything. Thank you very much.
Oh, I had so many Instagram doctors message me, and not literal doctors. Like
Oh,
they were offering
like
me their
Dr.
medical
Google.
advice. I'm like, what experience do you have in this medical or mental field? But again, I know it came from a good place. It was just so overwhelming. I was like, they were not offering suggestions, but telling me what I should do. And I was just like, man, what, why do you think you know me when you don't? And now I'm practicing this now because of that experience is before I offer advice to somebody, I now look in the mirror and say it to myself. and see if that advice is actually truly meant for the person I'm about to give it to, or is it meant for somebody else?
Ooh, I love that. Like, is it just to feed your ego to make you feel like
Exactly.
you're making a difference instead of for them? I like that. That's
Yeah, 'cause
interesting.
I had some
Is
people
that a
offer me
therapy trick?
advice. No, that was something I was just like, because I started saying, I was like, man, look in the mirror. What are you doing? Why are you telling me to do this? I know you. I've seen you out in public. You'll offer that advice to yourself. And I feel like that's what they're doing. A lot of people are projecting advice they want to give themselves when giving it to when giving it to another. And I just feel that's a good practice for me because I want to make sure when I say something, it's coming from a good heart. The intent is to truly be there for a friend and not project things that I feel like I need to do on them
Well,
because
I
I
think
see similarities.
I mean, you don't, that's a great lesson for anyone, right? Like, you don't have to literally look in the mirror, but if somebody is talking to you and sharing, you can say, do you mind if I share what worked for me? Or are you looking for advice at this time? Like, or you could
Yeah,
just listen because a lot of times people just want to be heard and they want to share and they want to know that they're not alone, right? Doesn't mean that they want you to give them a solution to
advice.
the problem, right?
Yeah, telling somebody what to do when you hardly know them is a bold move.
Have you been on the internet, David?
I know it's exhausting, and if it
Some
weren't for my job, I would
comments on the
hide from it.
shorts. Uh,
You're right.
they're like you. So one of the clips that we put out was talking about some of the people that you met in rehab and how they were prescribed opiates when they were children, and that led to, them being addicted later. And the comments on that short are like, well, what about us with chronic pain? Blah, 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 blah. Like, it's like, we're not saying people with chronic pain shouldn't have their drugs. We're saying a
Right.
10-year-old probably doesn't need fentanyl laced opiates for a oral surgery. Like, come on.
Right. Yeah, I have learned that it's very easy to get pills if you say you have a problem. And I think the important thing is, and I've given myself this advice in the mirror, is to advocate for yourself and be aware of what you're being prescribed, what's being pushed on you. Because that was one thing that while in rehab, I left rehab not being on no pills, and I did that intentionally because I was fine without them. My issue was ego and pride, not accepting the fact that I need therapy. I need to talk to somebody. Do I need to be on an antidepressant? So far, no. And I don't. I was told I have situational depression. I was like, well, if it's
Right.
situational, then
It'll pass.
let me do something I've never done before and talk it out with a stranger, an expert, an educated person who knows what they're talking about. And that's what I did. But while in therapy, I met with a psychiatrist, a couple of them, and everybody there is going through different stages in their life. They've had different versions of trauma, and prescription pills are sometimes needed. But for me, talking to a psychiatrist, I mean, I had a doctor, very nice man, but he was like, "You think you're bipolar?" And he was like, and I was like, "No." And I laughed at him. I was like, "No, I don't think I'm bipolar." And once I rejected that, because I could have very easily said, yeah. And then next thing I know, I have a prescription pill. That's how easy it
Yeah.
would have been for me to get on a pill. And the next question he was after we rejected that possibility was, are you, oh, what was the diagnosis? Mano or hypomanic? Hypomanic. And I didn't even know what that meant.
Me
And
either.
I asked him, well, what's hypomanic? He goes, well, you work out in the morning and you say you're not sleeping well, and perhaps we can give you something to control this if you're hypomanic. I was like, I'm
So
working out.
calm you down and take away your natural energy.
And I was like, first of all, I'm not sleeping because I'm in rehab. I'm having anxiety. I'm not
Right.
exactly the happiest person here, and I'm working out because when with
What
this
else are you
particular,
supposed to do?
I have you have two options, pretty much three actually. You can color in your free time. You can go
Thank you.
stand around and chain smoke cigarettes, or you can work out. And I opted to work out. But that was another thing that I was trying to be diagnosed for. And again, I'm sure it came from a good place, but I advocated for myself. And I looked at this doctor. I was like, no, I'm not hypomanic. I'm a very energetic person, absolutely. And I work out for my health benefits. And I'm having a certain sense of anxiety while here, but I don't need to be prescribed anything for whatever this hypomania thing is that you're
Do you
mentioning.
feel like that doctor wasn't seeing you and he was just seeing another person in rehab?
I think he had 100 patients that he needed to see that day, and he was just trying to breeze through it and
Yeah.
trying to help out people at the best to his ability. But that's how easy it is to get prescribed a drug, and 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 that's a dangerous situation when you're prescribing pills to a bunch of people who are addicted to
Listen,
escaping whatever their illness is
I am
or
so
problem.
lucky that I don't have that addictive gene because I was going through after the brain surgery, obviously had some kind of mental changes, like structural changes. It affects everything, la la la. So during, I think it was COVID, coronial times, if you will. So like 2020, 2021, like things just, I wasn't, you know, as quick
Right.
as I've been. I couldn't recall words. So I went and I got tested for ADHD. But before the testing, I met with a psychologist and told her, these are the symptoms that I'm having. She's like, oh, great, let's put you on some meds. So I got prescribed stimulants, like lots of different stimulants. Um, they didn't really do anything, they just make you
Mm.
sort of hyper focused. And my boyfriend at the time was like, you're weird. I'm like, well, I know. But he's like, no, like you're like it's like I can tell when it fades off. Like you're like a
It's
different
make
person.
Yeah, he can tell there's something different about you.
Yeah, and I couldn't tell. I just felt like I could focus longer on one task. I wasn't doing all the things, but I had something that you're not supposed to do is take other people's meds. And I had tried someone's what did Riddle? No, not Ritalin. What's the other one?
Really? Mm.
The one that
I've
everybody's
learned
on.
so much about drugs after being in rehab, but that's one I can't think of.
Yeah, it's not Ritalin, but it's the other one.
Just make up a name.
Well, I took half of a pill and cleaned my entire house, and I was like, "Wow, this stuff is amazing." But then the next day, I was extremely depressed.
Well, now
So
you're
it
hooked
had
on
like a
a pill.
rebound effect. And I dated a guy who was taking modafinil, which is a stimulant for fighter pilots to keep them awake.
Right.
And he like uses it to get through work. I don't know. I didn't realize that he was addicted to cocaine. But anywho, he gave me a modafinil because they're not like you can get them on the internet. You don't need a prescription for them. So I took that, and then the next like 2 or 3 days, I was so depressed. I'm like, what is wrong with me? And I realized that boosted all of the chemicals in my brain to make me so active and hyper that
Yeah.
then they were gone for the next couple of days. So I was, dopamine deficient, serotonin deficient. Like it was bad. So then I
Yeah,
never took them again because I was like, no, I don't want that depression rebound.
your body was like, "Hey, we don't need to do this naturally.
Yeah.
Let's use a synthetic version of this."
Ugh, no, it was
I'm trying to look. I know what the pill is. I know it.
Adderall.
Adderall. Yes,
Adderall.
which is highly addictive to a lot of people. I mean, I met
Exactly.
a
So
lot.
I am lucky that that didn't happen. And my one friend, like she had ADHD, she needed Adderall, and then it escalated into other drugs, right? And
Yeah.
same. I have a friend who was addicted to prescription pills for the longest time and self-medicating with that because it started out as situational depression. Somebody gave them something for it, and then when the situation was over, they were addicted to it.
Yeah, benzos are very dangerous, and I'm grateful that I fear them. I was always shocked that that's what would be prescribed to me. I can't tell you how many times I've been given Xanax, Klonopin, lorazepam, you name it. I've probably been prescribed it, and I ended up
Did you
just
take
throwing them
it?
away. I would take them, but I did not like how they made me feel.
No, you're like a
It,
zombie.
right, and it completely shifted my personality and my moods, and I was like, this is not going to work for panic attacks and anxiety. There's got to be a better way. And fortunately, I did find a natural way, um, and that's just breathing exercises and working out and taking care of my health. I mean, that was the
Yeah.
biggest thing that eased my anxiety symptoms. can't even tell you the last time I had a panic attack when I wasn't in rehab. Rehab was just full of panic attacks. I'm like, oh my God, why am I here? I can't believe I'm here. It was a good there, but it's a very daunting and scary thing to be in rehab.
Well, and they
Um,
force you to be, well, I don't know. I take that back. In rehab, do they require you to share, right? Do they have group like
oh, all the time.
so
Yeah, I
you
mean
have to
that's a
be
big part of it.
vulnerable as part of the process. And a lot
It's
of people are there because they didn't they chose not to be vulnerable. They chose to take a pill or whatever, right?
right. Yeah, right. Well, real quick, I do want to mention that, like, while I was there, when you're in detox, you get prescribed a lot of pills too. I think I was on 7 different pills the first 2 weeks,
For
and I felt hot.
detoxing?
Yeah, it was high as a kite until I was like, I need to wean off of these because I don't know what the heck I'm taking. I didn't understand anything. I know you got to be careful when you come off of as much as I was as drinking on the last bender because
So
there's a
it
risk
was
of
to
seizures and strokes.
yeah, it was to help your body not
Right.
seize, right?
And coming off of alcohol, I started having that same anxiety that I experienced 7 6 years ago, and that was helpful. But when I got to a place where I was like, all right, I'm good. Let's get me off of these things. And they're like, are you sure? I mean, we can just lower the dose. Or I'm like, no, get I don't want to replace alcohol with a pill if I don't have to. So, and I know
Isn't
there
that
are
how
people out
Amy
there.
Winehouse died? Is that
Oh gosh, I don't
she
know.
had seizures from stopping drinking.
Yeah, it's very coming off of benzos and alcohol. From what I've learned, from what I understand, you can die without detoxing medically. It's very dangerous. Um, because yeah,
Which
your
is
your
so
body.
weird because why do we drink? Like, why is it okay to have if it's so bad to get out of your system? Like, you know what I mean? Like,
We
why is
got
this
it
something that we willingly ingest to
because
then,
it's societal. I mean, look at it. You can't listen to a single song. You can't see it. You can't watch TV for more than 10
that's true.
minutes. You can't
Everyone's drinking
drive.
wine or
Oh,
beer.
we've glamorized it. It's
Yeah.
it's a lifestyle. I mean, what do you do when you go out with friends? Did you go out and just sit and read a book together? Anybody go bowling
I
without? I
mean,
mean,
yes,
you
I have book
can,
club, but they bring
right?
wine. You're right.
And I very much enjoy going out and not drinking and doing these things. But 90% of the people I'm with they have a drink in their hand because it's
Yeah.
the norm. It is that's a topic for a different time.
Yeah.
Um,
100%.
but yeah, it is the pill thing. The pill thing drives me crazy. Uh,
Well, how does that tie into, you were t talking about, you've been vulnerable and people are saying, "Hey, take a pill." What's some of the other advice that they've been giving you? Like, are you going to AA? Is that a thing that you need to do?
AA was advised by several people. I was like, oh God, I'm gonna be very clear. I'm not a fan of AA. I appreciate what it does, and it provides community for a lot of people, and it gives people structure. It gives them a schedule. Gives a lot of people something to look forward to. I fortunately have a great support system, and I still to this day, they say only one person can say you're an alcoholic, and that's yourself, and I still don't say that. I
Because
I
yours was situational. So you don't see yourself as a
right.
daily drinker because you weren't a daily drinker. And I feel like AA is for people who couldn't make it through a day or a week without a drink. But at the end there, you were that way.
Right. I mean, if you look at my resume of the consequences that I endured from drinking, people will go, "Whew, you're an alcoholic."
Okay.
Because on my benders, I completely lost my mind. But AA is great. But I think without anybody, I truly believe this. And again, I'm no expert, but I've read a lot up on this. And there's a lot of literature out there that will support what I'm about to say is that anybody who is quote unquote addicted to a pill, to a drug, to alcohol, it, in AA, they base it around it being alcoholism as a disease. That makes me cringe when somebody says my disease made me do this. Like it is not how. does that classify as a disease? It was a decision made, a
Right.
decision made to cope with an underlying issue or illness. That's the disease.
Well, then
That
it becomes a disease once you're addicted to it, right?
sure you can become addicted to it, just like you can become addicted to chocolate or addicted to porn or addicted to gambling or addicted to shopping. You're
Right.
hiding
So
from you're
addiction is in itself a disease.
I don't
Playing devil's advocate over here.
fair enough. And I won't argue semantics, but without dealing with the underlying issue, you're never going to fix that solution that you were using that has now been consequential in your life
Oh,
negatively.
100%.
Right.
100%.
So AA is great, but if you're not going, for me, therapy has been my number one tool. Medicine, therapy, working out, and being vulnerable. This right here, talking about it
Mhm.
is the most effective thing I have done, and something I've never done in the past is
Do
being
you
open and honest about it.
do you think when you said people say my disease made me do this, that's just one step closer to them being able to admit that they did it, right? They've decided that they have this is going to piss a lot of people off, but like you said, like they decided that they blamed their disease for the actions that they took, right? But like you
Right.
said, they took those actions. So is this maybe a way to get them into
Perhaps
realizing that it's their fault?
again, this is just all my observations. For
Yeah.
example, I heard a gentleman say his disease almost led him to drink tonight. Because and I was like, well, wait a minute. Your disease almost led you to drink tonight. And then he started saying because, and I was like, there it is. What's that reason why you were going to drink? What were you dealing with in your life? That's
Mhm.
the issue you need to, that I, if it were me, that's what I would focus on.
Well, okay, I will give you this. So for me with anxiety, right? When it was really bad, I named it. And my friends know I named her Ursula.
Your
Ursula is my
anxiety.
anxiety monster because she's got her tentacles and everything.
Oh, yeah.
So on some days, I'm just like full on, can't make her stop talking, right? So I named her because she is the anxiety monster. I am not. So some days I'm just like, fine, you know what? I still need to feed myself. So me and my anxiety monster are going to the grocery store and we are going like, so I'm not blaming her for being the reason that I can't go to the grocery store. She just happens to be there, right? Like, yeah,
Right.
I'm spiraling. I can't leave the house. Oh my God, blah, 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 whatever is happening. But then the second that I disassociate from her and say, no, that's her, I'm the person observing her,
I
then
like this.
you
This is a
take it
great
back.
tool. Yeah.
Yeah, so that was actually something that my cousin, who was a therapist, taught me because she's like,
I
"Yeah,
love
dude,
that.
sometimes it's just hard, and you just have to say, well, me and my anxiety are gonna go pick up the kids from school or whatever it is." And I was like, "That's interesting because if you realize that you are not the voice in your head, you are the one hearing the voice. Boom, changes everything. Like you
Mic
are not
drop
you.
that. Yeah.
You are not this. We are here.
I want to name
Name your
my
monster."
my monster. I'm going to call him Doug. It's definitely
Doug
a
doesn't
he.
sound like a monster. You
Oh,
mean
you
like,
don't know the Dougs that I've known in my life. I've known two of them. They were not
oh,
good
okay.
people.
All right
Yeah.
then. Doug it is.
Get out of my head, Doug.
You could have Cruella.
No,
I
that's a
like
chick
going with
name.
Disney villains for some reason.
I love Disney too much. I don't want to taint Disney
But the
for me.
villains, like you could have Scar. He was
Even the even the villains deserve to be loved. They had childhood trauma that led them to be such a monster, such a cruel
well,
person in their life.
and that can be said for everyone, but then again, it comes down to your choices. You can't blame your parents or your trauma for everything forever. At some point, you got to say, "I'm I'm a grown up now. I take responsibility. I can change the path. I give
Yeah,
love to my younger self." You know,
I
hooey, as
love
they
that.
call it.
We only have a couple more minutes. I do want to talk about AA in another time that we do this,
Okay.
but dive more into that. I do want to wrap up with one question that I has been very challenging after you become vulnerable. I think you can certainly relate to this with the brain surgery. and everything you went through medically, is the question that everybody asks, and it always makes it awkward. How are you?
Ugh.
How I was like, I just told you I had brain surgery. How do you think I am? Or I just
Fine.
told you I
It's
just got out of
fine.
rehab. Do you
Everything's
have
fine.
how
Right? What are
much?
you supposed to say?
I know and I think it's some because I can tell people are just trying to like approach you and be supportive, and but that question is just so
It's ick.
insincere and
It
vague.
gives the
Yeah,
ick.
like don't text me, don't call me and say how are you. Say let me know how you are. I want to know how you are. You already know how I am. I just shared. I just told you.
Yes, but how are you? Please open up to me further because I'm somebody that you knew, 10 minutes ago, and I really feel connected to you now that you were vulnerable.
Yeah, come up with a better question. Ask me how my day is. I can tell you that. But you already know how I am.
I think maybe yeah, what is that? Because again, I hadn't put anything on the internet about the brain surgery until it was like my anniversary, like a year or two or four, or I don't know, because now it's been 6 years, which is insane. But I didn't
Wow.
want anybody to know because if I wasn't going to be here anymore, then, I don't want people sending me flowers and being like, oh my God, it was so nice to know you. Whatever. Like, I've got to face this. And then when I get to the other side, we could talk about it. Right. And then people are like, oh my God, I had no idea. How are you?
Again, it comes from a good place when asking that question. But
How am I? I'm alive. Thank you. How are you?
I wish I had. Oh, that would be cool if your brain was leaking and people were able to go, like, how are you? I'd be like, well, my brain's leaking. How many people can give that response?
Well, when I used to go to trivia night, I would name my team It's Not a Tumor. And then they're like, why did you call it It's Not a Tumor? I'm like, well, because it is a tumor and I'm having brain surgery in a week. So, and then
And
they're
what they
just like,
say? They said, how are you?
like, great. Clearly, I'm playing trivia.
How would you like me to respond to that? How are you? I'm
Yeah, leave
having
a
brain
comment.
surgery.
Leave a comment. Let us know how we are supposed to answer. How is David supposed to answer that question? How am I supposed to answer that question? Because it's not like I'm going to say, I'm going to say I'm fine.
Just
I'm
ask the
fine.
genuine question that you want to ask. Like in your like, how are you? It's like, what the real question they want to know? Do you think you're going to die?
Yeah.
Are you
Do you
afraid
have
of
side
dying?
effects?
Right.
Like,
Or for me, coming out of rehab, like, well, are you still drinking? Are you drunk now? Like that's what they want to
yeah,
know. And I'm like, just ask the question you
exactly.
want the answers to. Don't.
Cut through
How
the
am
small
I?
talk. That's what we're here for.
Yeah, we
We
got
we
limited
are we
time.
go deep.